Chronic venous disease is disease in the veins which is usually caused by deep venous thrombosis or DVT blood clots. Blood clots cause blockages in the veins which don't allow the blood to get out of your legs and can cause venous pooling and high blood pressure in the veins. Chronic venous disease is usually recognized by swelling in an extremity that's worse on one side than the other and is usually associated with a history of blood clots, although studies have shown that over a third of patients with chronic leg swelling have evidence of a blood clot even though they think they've never had one. Blood clots in the veins are similar to blood clots if you cut yourself on the hand. Over time, they go from a clot to a scab to chronic scar tissue, and that happens inside the veins as well. This chronic scar tissue that builds up inside the veins can cause blockages, which causes chronic swelling and pain in the legs and can eventually lead to ulcers. Chronic venous disease is actually very common and affects, thousands of Americans. In fact, we think it's almost 9 times as common as arterial disease and is just under-recognized. Chronic venous disease is usually diagnosed by primary care providers or patients with chronically swollen limbs. Once they're referred to the Vascular Institute of the Rockies, we have them evaluated by certified vascular ultrasonographers that do a non-invasive ultrasound to look for chronic scarring inside the veins. Traditionally, chronic venous disease or chronic venous scarring is treated with compression stockings. And that certainly treats the symptoms of pain and swelling and is the most effective way of treating ulcers or wounds in the legs caused by venous disease. If the patient does have chronic scarring, then they may be a candidate for an endovascular procedure, which is an outpatient procedure to open those veins, such as angioplasty, or opening and breaking up the scar tissue inside of the veins, or stenting. Sometimes we can place stents in the iliac veins up inside the pelvis, which allow better outflow from the legs. Here at the Vascular Institute of the Rockies, we specialize in the treatment of chronic venous disease and have a whole spectrum of therapies, including endovascular therapies, to open chronically scarred veins and provide better outflow from your legs.